portion, because all the marks are on your hand. If you can able to answer every question, every single question, I think you will get more than 17 or 18 in this question. And on average, I got almost more than 60 topic, including skill and knowledge portion in the whole exam, almost 16. So I couldn't do that much good in a few stations, but I can assure you that in history portion, I was just a rocket. I was able to ask you, able to answer all the single questions, and I was damn sure I got more than 18 or 19 in this portion. So this portion is the key for doing better in your skill portion. So always practice. I have seen so many people that ignored the history portion, and they was puzzled, and though they don't know how to answer and how to complete, and time is the most vital portion this station. So always practice again and again and try to complete your history portion, this portion, right? So did you get it, doctor?
Yes, Bhaiya.
So let's continue. So this one is which portion? Okay, pale blood in urine. So this is the hematuria. So for the hematuria, which one was for the hematuria? Dr. Sharmin was for the hematuria. So doctor, are you here?
Yes. Yes.
Here I'm going to start your timer.
Okay.
So doctor, you get 1 minute in your hand to read out the question.
Volunteer, who will be volunteer?
Volunteer, so that I can I can sort out the mistake done by Dr. Sharmin. So is
I
there,
will volunteer.
okay, doctor, what was your name? Sorry, doctor.
Jane.
Jane, Dr. Jane. Sorry. So Jane is the volunteer, and Dr. Sharmin is the candidate. You have 1 minute on your hand. Whenever you are done with your question, just let me know that you are done. Then you will start your station.
Okay, I'm starting. Okay.
Just read out the question.
I'm reading. Okay, I'm reading the question. Wait. Okay.
Are you done, doctor?
Yes, I'm done.
Okay, your time is started.
Hello, good evening. I'm Dr. Sharmin, one of the surgical doctors here today. May I confirm your name and age, please?
Hi, I'm Andrew, 56.
Hello, Andrew. Nice to meet you. So today I have been assigned to ask you some question, the symptoms you were going through. And during our conversation, I might take some notes. Is that okay with you?
Yeah.
Okay, so can you tell me what brought you here today?
Doctor, I'm having blood in the urine.
Okay, it's been 5 weeks, right?
Yes, doctor.
Okay, so do you have any pain right now?
No, just a little bit sometimes on the left side.
Okay, so when did you first time notice this blood is coming into your urine?
Doctor, you just said 5 weeks.
Okay, yeah, I'm so sorry. Yes. So how many times this happened in a day?
Yeah, so it has been coming whenever I pass urine.
Okay, so is it getting worse day by day?
Yeah, it has increased a little bit.
Okay. Did you notice the color of your blood?
Yeah, it's like maroon, like reddish, dark reddish.
Okay. Did you notice, is there any blood clot?
No, doctor, not that I have noticed.
Okay. Is the blood all the time, or like at when you start to pee at that time, or like throughout?
So it comes when it's ending.
All right. Do you have any kind of back pain?
No, doctor. No back pain.
Okay. How is your appetite nowadays?
It has come down a bit. I don't feel like eating.
Okay. Do you notice that you are losing weight?
Yes, doctor. My friends have told me that I've become thin.
How much did you lose weight?
Um, I think probably 10 kgs or so.
10 kgs. Okay. So do you have recently taking like beetroots, any kind of
Uh,
keratin type fruits medicine?
no, not that I remember.
Okay. So can you tell me recently you have suffered from fever,
No, doctor. I've not had fever.
any body maturation?
No, doctor.
Okay. So recent history of any hospital admission?
No, doctor.
Are you taking any regular medicines?
Yes, doctor. I take medicines for BP.
Can you mention the name, please?
I can't remember the tablet right now.
Okay. Do you have any kind of allergy history?
No, doctor.
Okay. Tell me something about your family. Like, is anyone is having this same condition you are having now?
No, doctor. I have no one in the family has.
Okay. I would like to ask you some personal question. Is that okay?
Yes, doctor.
What do you do for a living?
I work in a factory, doctor. A dye factory.
Yes, yes, I have seen that one. Okay. Do you have history of smoking?
Yes, doctor.
How many cigarette per day?
So I smoke 2 packs per day.
Do you have history of like alcohol?
Occasionally, when I'm out with my friends.
All right. So tell me, what is your idea about your condition?
Doctor, I don't know why I'm getting blood in the urine. Um, it has been coming and it's not stopping on its own. So I'm just worried it's not something serious.
Okay. What is your main concern?
Uh, I don't want it to be cancer because I have my family to take care of.
I understand. I really understand. It's very early to say like that. Don't get panic. So we will take your history and go some blood investigations. I will discuss this with my consultant. Don't worry. Don't get panic. All right. So I'm going to ask you some questions. Just answer me yes or no. Okay. So do you have any history of chest pain, cough,
No,
any joint pain?
no,
Do you have any problem with your water work?
no. Yeah. I do have blood in my urine right now.
Yes. Apart from that, any other complaint?
No.
Burning? No. Okay. So, uh, is there anything I might miss to ask you? Would you like to inform me?
Nothing specific, doctor. I think we've covered everything. I just feel very tired nowadays.
All right, Andrew, thank you very much for your cooperation. I will come back to you.
Thank you.
All right. I'm done.
Okay, doctor. You have taken 5 minutes, and before 23 seconds, you have completed history taking. And do you have any comments regarding your history taking? Then we'll discuss about it.
Mm, I tried to finish within time because last time I couldn't finish, so I tried to finish within time.
Yesterday, you took much more time, and you was
Yes.
take 2 more minutes to complete your history taking. Today is improved. Time is quite improved, right? So, any other
Uh,
problem?
I have one question. She didn't ask any questions related to prostate.
We'll come back to you, doctor. We'll come back to you. We are the main candidate for today because you are the actor. So we'll come back to you. So at first, come to Dr. Sharmin.
Yes. Yes. I was actually trying to exclude that bladder cancer, renal cancer, and like any kind of infections and like and stones. So regarding prostate, I didn't ask anything specific actually.
Okay, so could you tell me what is the commonest symptom of the any lower urinary tract abnormalities?
Lower urinary tract abnormalities.
Yes,
Lower urinary tract abnormalities means like
symptoms, lower urinary tract.
urgency, frequency. If it is a male patient, urgency, frequency, hesitancy.
Not only for male patient.
And then can low in pain, can hematuria.
Urological background.
I didn't understand the question, like how to answer.
What are the commonest symptoms whenever any abnormalities that occurs in the lower urinary tract, or in a word, lower urinary tract symptoms?
Symptoms, yes, it could be like low in pain and like hematuria.
Pan and hip disc.
Mm-hmm.
Pan and hip disc.
Yes.
Obstructive.
Yes.
Pan frequency, urgency, urge incontinence, nocturia, nocturnal enuresis, hesitancy, incomplete voiding, pore flow, dribbling.
Okay, in a normal word, in our subject,
Then ischenguria, difficulty,
usually
pain,
use
pain.
pan, eye,
Pan
That are
and hip
energy
disc.
pan,
Pan and hip
storage,
disc. Hip disc.
voiding
Storage and
prostate.
voiding.
This is for the bladder, urinary bladder abnormalities, and the function of the bladder is store, and IPS is for the void,
IPS prostate.
void, or
Void.
urethra, right, or outflow. So whenever any problem that occurs in the urinary bladder, the symptoms includes frequency, urgency, urge incontinence, nocturia, and nocturnal incontinence. These are the voiding symptoms. And IPS means difficulties with the initiation or incontinence, intermittent flow like this way, and P is for the poor flow, and S for the staining. Right? These are the problem with the urethra or the bladder outlet obstruction. Right? So these are the.
Because we may divide the symptom as like storage, voiding, and post maturation.
Yes, I'm telling the same thing there. Same thing. This is the storage, this is the store, and this is the void. So, Dr. Shamin, I think you didn't go through these questions at all. And
No, but Dr. Rifat, I have one thing. Like it's a time, right? So hematuria means first of all, I think my differentials will be because in for MRCS BPH mainly we are focusing on that prostate. I mean lower urinary tract symptoms. But in hematuria, as I studied, like that all the blood.
It may prostate cancer also. Prostate cancer may hematuria.
I asked about that hematuria, but I asked weight loss and those things. That's what I was thinking. Like it's okay, like weight loss, cancer.
I mean, in your
Yes.
whenever you find the hematuria, your diagnosis always be bladder cancer. Always that answer diagnosis won't be changed. I have already told you in the very first day that whenever you find the parectal bleeding, your diagnosis would be colon cancer. On the same way, whenever you find in the hematuria, the diagnosis would always be bladder tumor, right? So your diagnosis fixed. But you will have to.
Yeah, my diagnosis, I would like to exclude if you ask me to finish my presentation, then I could say like I would like to, my main differential diagnosis is bladder cancer.
You can't avoid the main differential. So prostate is the one of the most important and main differential for you. So you can avoid
What
this.
question for prostate cancer should I ask?
This kind of questions, LUTS, frequency, urgency,
LUTS.
LUTS.
Lower unit tracts, LUTS, roots.
We are discussing right now.
Also bone pain.
Both point.
Yeah, I asked about the back pain. You said no, I think.
So Dr. Jain, just now it's your turn to talk about Dr. Sharmi. Could you tell me?
So she asked me about blood in urine, and she asked me about pain. I had told her pain first time, but she didn't ask me where it is. I told pain. Sometimes I feel pain on left side. She didn't ask more about that. That
You
was
say
one thing.
sometimes.
Otherwise, she did very well
Sometimes.
actually.
No,
You said, doctor,
case is painless.
sometimes. But you said
Refer,
sometimes,
your case
occasional,
is
right?
painless
No,
hematuria
it
and dull ache from loin to groin.
Yeah, in
And
the
yeah.
history
So
it's
that
written,
industrial worker. But actor is
in
saying the
history is
pain.
written like painless, okay? And here mention even the like
Actor,
loin dull pain on the left side, but it's painless. Then again, loin dull pain, in the history, in the same.
pain, yeah,
so the pain is only since 2 days. That's what it says. Before that, it was all painless.
okay.
And the pain is not like severe blood in when you're passing urine, that pain is not coming. It is very severe. Only then sometimes loin to
Yeah,
says, I think.
if
It's a
doctor,
very confusing point, but then yeah. But
if the
if someone says pain, you have to go a little in detail. I think that's what the concept is. I know it's very
but ma'am, I think like if
counterintuitive.
you're saying occasional pain, so like within time we cannot finish then,
Yes.
that's like if you're saying like pain, if I'm going with Socrates, it will take like 2-3 minutes. Socrates has so many points, right? If
But
I'm going to ask it.
you had 2 minutes extra, so it's the. I mean, I'm just talking from the point of view of on the other side. Even I think like you only, and I miss a lot of points because I think why should I ask? But I think they don't think like us.
Yeah.
Okay. Okay. Just let me remove your confusion. So first thing, in your station, the actor are not supposed to say any pain. Just remember first thing. But your luck won't always favor you, because all the actors are not that much good. They might misguide you. That's why for the actor, doctor, for the Jane, always remember the actor are not supposed to say any pain, because the patient will only have the painless hematuria, and the diagnosis is bladder tumor. But for the candidate, for the Dr. Sharmin, whenever she asks that she has some pain, don't dare to forget to go for the Socrates. If she say she has some pain, always go for the Socrates. Whether there is any pain or not, if the actor says she has pain, always go for the Socrates. Right?
Okay. Okay.
You
Okay.
understand whether it is present or not, but you are acting like you know everything. You found already your question, and you are just doing doing the thing you are supposed to do, and you are not following your actor. That
Mhm.
really means, that's why if the actor say that she has some pain, always you will have to go for the Socrates, and it won't really take 2 to 3 minutes. You will have to be very much habituated with the pain. And I can remember I usually used to take maximum 30 to 40 seconds to rule out the pain. So just
Okay.
practice
Okay, doctor.
and complete within 10 10 sentence or 9 sentence within 30 to 40 seconds, and you will be very much habituated with this. So two instructions for the actor. You are not supposed to have any pain, but if the actor say any pain, you'll have to go for the Socrates, right?
Okay,
Okay.
doctor.
Now from my view, Dr. Sharmin has improved very well. She is good from the previous day. She explained herself well. Greetings was also good, but one mistake you have done is a very great mistake, I think, that whenever the patient was saying that she has some blood mixed urine, you didn't give any sympathy for the patient.
Yeah,
And
I think, yeah,
it's a very big mistake.
I forgot today. Yes, you're right.
Mistake, and you are not really supposed to do such kind of mistake, because the layman examiner has 5 marks, and I think if you do this mistake, you will lose almost 50% on your mark from this portion, because that totally make your impression very bad from the beginning of the history taking session. So always have some empathy when the patient have some problem. Okay, so I mentioned you to tell that you are having some notes when you are taking the history, and I also told you when the patient is giving you some positive findings that the patient is having problem with her job, she's die work or something like that, and you didn't give any emphasis. I said you to only tell, I am writing it down and very loudly and clearly so that the examiner can hear you, that you are telling that you are finding the positive findings, so that will make a very good impression, I think, right? So
Yeah, yes.
and one thing, always remember, family history is always a personal history. So you are not supposed to ask the family history before seeking for the consent again. So always try to, you did the same mistake yesterday, and I am correcting you again today, and until unless you correct yourself, and I'll keep telling you that family history is always a personal history. So you'll have to ask the seek the permission to ask the family history. So after asking the question, what do you do for living, who lives with you at your home, what are you doing for, like this question, whether you do take any alcohol or smoking, and between them ask, is there anyone in your family is having the same problem, right? So family history,
Yes, doctor.
personal history. So your I always I yesterday said your voice will have to change with the patient, and even your facial expression will also have to change with the patient. So keep your mind that will have to just act like that way when she is telling about her sufferings. You'll have to fluctuate your voice, or I am actually sorry, and just try to act like this, that you are having also some pain. So you didn't mention any LTS, and these are the most important differentials. You didn't go through this portion. So always, I yesterday told you that you'll have to, if you are have completed four, minimum four differentials, that's okay. Don't go for 7 or 8 differentials. You'll have to go for only four and maximum 5. It's okay, but uh, if you do so many differentials and you didn't and go through the main differentials, that completely wrong concept. So LUT is the must in this portion. So you'll have to go through the LUTS. I think that will
Okay.
give you much more time. And in the systemic use reviews, you again ask the patient about the waterwork, and patient started her problem with the waterwork. So don't ask the same question. And so
Yes.
you started your station without having any empathy, and completed your station asking the same question again. So do you have any problem with your water? And that will give you a very bad impression to the examiner. So, so what do you say right now?
No, thank you, doctor. Thank you for correction. Yes, I did the mistakes actually. And I think today I forgot to show too much. I mean, I didn't show the empathy
You
to
are
the
much
patient that much.
you are much more fluent today, and I'm very much happy for that. But you did some great mistake, and inshallah, if you try this way again and again every day, you will do much.
Sure. Inshallah.
Okay.
Yes. Thank
Now
you,
come
doctor.
to another 3 minutes, Dr. Sharmin.
Yes.
Would you like to say the positive findings or the present the case?
I would like to present the case.
Yeah.
So the gentleman came with 56 years old who is working in a factory, came with a complaint of painless urine since last 5 weeks, and now it is getting worse day by day. And she noticed that while she's passing urine, that time she is having blood, and she is a smoker and occasionally drink alcohol, and she is a hypertensive patient and taking some medicine for that, and she has no history of back pain. She has a history of back pain and weight loss, a loss of appetite. Apart from that, no history of fever or like burning maturation. So on behalf of my history, my main differential diagnosis is the bladder cancer, And
Doctor,
I would like to,
you are wasting a
yes,
time. You have only 3 minutes in your hand. In your hand, you'll have to present the case. You'll have to give the investigation differentials, and also have to diagnose, and also have to ask few more questions like treatment. And you are wasting almost 2 minutes to just to present the case. So that also a great mistake. So just tell me the most important positive finding.
okay. The gentleman, 56 years old, who is working in a factory and who came with a complaint of painless blood in urine since last 5 weeks, which is getting worse day by day. He's a smoker, and the patient he has also complained of back pain and weight loss. Apart from that, he doesn't has any other symptoms. So on behalf of my history, my main differential diagnosis is the bladder cancer, and I would like to exclude the renal cancer, prostate cancer, that any kind of renal stone or urinary tract infection.
Yeah, okay. Whenever you are presenting the case for the first time, you started your presentation that the patient is a male, and at the middle of your history presentation, that your patient become a female from the male. Did you notice it?
No, because I was thinking my actor was female, so suddenly maybe I turned it.
Okay, so that's also a great mistake. So I think this preset exam, just always try to remember the positive finding within 2 to 3 lines. That's okay. Don't say so many things. They will just wait to hear the positive findings. Just try to remember what are the positive findings, what the positive findings you will get in the hematuria. One is the patient is age, and another one is patient will have painless total hematuria, and there is episodic also, though it is not given in our conventional book. So usually, as I'm from a urological background, and I found so many patients like from the bladder tumor, and we used to ask the patient how many episodes you faced from the beginning of the hematuria. The patient says 3 to 4 episodes, and we'll have to ask the how does it persist like this way. So the patient will have painless total episodic hematuria. Patient will also have weight loss, and mention the weight loss if the patient can tell you, and anorexia, and patient also a smoker, and he is also working as a dye worker. So these are the most important positive findings that will conclude your diagnosis into the bladder tumor, right?
Yes, doctor.
Okay, so how would you investigate the patient?
So I'd like to do some urine investigations. I would like urine deep stick test, urine culture sensitivity, microscopic examination, and a cystoscopy with biopsy. And I would like to do some other blood investigations like creatinine and full blood count, urea electrolyte, and prostate specific antigen.
Okay, so what is the most important investigation?
I would like to do cystoscopy and biopsy, and also CT scan.
Urine cytology.
Cystoscopy and biopsy,
You
and
mentioned
that,
about urine cytology, doctor.
yes,
Okay, so
cytology, yes.
the confirmatory diagnosis is cystoscopy and biopsy, right?
Yes.
So how would you treat the patient?
So according to the staging and grading of the tumor, I would like to give surgical treatment will be transurethral resection of bladder tumor, radical cystectomy, and non-surgical we can give chemotherapy, radiotherapy, or immunotherapy.
So are you a urologist?
MDT, ABC.
Are you a urologist? You are not supposed to do this kind of treatment. That might be the treatment option. So I have to mention, I would like to treat the patient in multidisciplinary team approach, right? So
Yes.
I already yesterday I mentioned this. You'll have to answer like this. So start like this. Then examiner will ask you what are the teaching options. Do you know? Then go for the thing that you have mentioned, right? So
Yes, doctor.
what is the immunotherapy that is we used to do in the bladder tumor?
I forgot at this moment. Sorry.
Okay, in immunotherapy we used BCG vaccine.
ECG
Oh,
vaccine.
yes, yes. I do remember. Yes.
Therapy usually we use in low-grade bladder tumor,
Yes.
that is intravesical mitomycin C, right? These are the most important things that are very clearly written in the Bailey Lab that might ask you, because you would get all the questions from your conventional books. Examiner may ask you from his own interest, so you'll have to know the very basic thing. So these are the most important, so you can write it down in your book. The chemotherapy is intravesical mitomycin C, and the immunotherapy is the BCG vaccine. So that ends our first station. Dr. Sharmin was really good, and she improved her